day, I am Aisa Hamza, your student nurse from University of Mindanao. So for today's video, I will be demonstrating the urinary catheterization for female clients. So the urinary catheterization is the introduction of urinary catheter through the urethra into the bladder for instillation or removal of fluid. So the purpose of it is first, to relieve urinary retention, second, to obtain sterile urine specimen, third, to measure the residual urine remaining in the bladder after voiding, fourth, to control urinary incontinence, fifth, to provide access for instilling medication into bladder, six, to maintain an empty bladder during the surgery, seven is to monitor early urine production in seriously ill clients. The material needed: external dutching tray, bedpan with cover, waterproof underpad, bath blanket, a tray containing with the following of pickup forceps, working forceps, lubricant, betadine, sterile dry cotton ball, and catheter, sterile catheterization pack containing the drip, OS, kidney basin, and the equipment for indwelling of catheter is Foley catheter, um, sterile 5 to 10 cc syringe filled with a distilled water, a triple distilled water vial, plaster, um, urine bag, um, and the last one is lamp. First, review the client health record and check the client chart for physician's order. The rationale for this is the catheterization is only done if with medical order. Identify the client and establish rapport. The rationale for this is to ensure the right client and elicit cooperation. Good day, ma'am. May I know your name and birthday? Okay, can I see your wristband? Okay, thank you, Mrs. Beth. Assess if the client is allergic to iodine or plaster. Good day, ma'am. May I know if you are allergic to plaster or iodine? Explain the procedure to the client to elicit cooperation of the client. So, good day, Mrs. Smith. So, your doctor ordered to do a urinary catheterization. Urinary catheterization is introduction of the urinary catheter through the urethra to the bladder for instillation or removal of fluid. Is this okay, ma'am? Okay, thank you, ma'am. Provide good light because good lighting is necessary to locate the meatus clearly. Provide privacy by closing the door or pulling the curtain. And the rationale for that is the client has the right to be protected from the exposed to the other. Replace the top sheet with bath blanket and place the waterproof underpad under the client buttocks. So this protects the bed linens from moisture and getting soiled. And place the client in dorsal combat position with the feet apart and drape the client. Performing hand washing is prevent the spread of microorganisms. So I assume that the client is in a dorsal recumbent position with the knee flex, and I'm gonna pour the sterile water and spread the labia and get a cotton ball, wipe, downward to the anus and discard the used cotton ball. And get another one and do this with the same opposite side and discard. And the rationale for this is cleansing the perineal arch prevented the introduction of bacteria and prevent the spread of microorganisms. So just assuming that this is a sterile kit, it's away from us and side and toward. Remember that the border is not sterile, the inside is the sterile of the patient, and the one is for the exposing only the genital of the patient. So I assume that I have a 10 cc sterile water, and I will attach the water syringe to the catheter and to the drainage bag. But first I will try if it will be inflate the balloon. So yes, it is good. It will deflate. Squeeze a small amount of lubricant over the sterile field and get a 2 cotton ball from the pack and place it on the sterile field, then pour a betadine. So the rationale for this, the organization promote efficient time and management. Put a sterile gloves to avoid cross-contamination of microorganisms. Place eye or fenestrated strip over the vulva area, exposing the labia. Lubricate 1 to 2 inches of the catheter tip and avoid clogging the lumens. The rationale for this is lubrication facilitates the insertion of catheter and reduce trauma to the tissue. And use non-dominant hand, spread the labia and identify the urinary meatus. Maintain the hold until the catheter has been inserted with the dominant hand. Disinfect the meatus twice using the cotton ball with betadine. Downward, then discard the used cotton ball and get another one. Downward. So discard. The rationale for this, cleans the area and minimize the risk of urinary tract infection by removing the surface of pathogen. So insert the tip of the catheter into the dimple-like structure below the clitoris, which is the meatus about 2 to 3 inches. And until urine flow, so do not force the catheter through the urethra, and instruct the client to breathe deeply and rotate the catheter gently if slight resistance is met. So the rationale for this is sphincter relax and the catheter can be entered the bladder easily when the client relaxes. So remove the catheter smoothly and slowly if you use a straight catheter. And if a Foley catheter is used, introduce a 5 cc or distilled water To secure the catheter, gently pull the catheter until retention balloon is snuggled against the bladder neck. So resistance will be met. So the rationale for this, create a balloon to ensure catheter retention and maximize continued bladder drainage. Proper attachment prevent trauma to the urethra and meatus from the tension to the tubing. So remove remove the first fenestrated drip and discard, and attach the catheter to the urine bag below the level bladder, and remove the cap of the urine bag and remove the syringe and discard. So I assume that this is the thigh of my client, and tape the catheter to the thigh to avoid reflux of urine to prevent infection. Place the client into the comfortable position. I'm going to be placing the urinary bag to the non-movable part of the bed. Do aftercare of other equipment use. Remove gloves and do hand washing. Hand washing prevents the spread of microorganisms. Document the following: date and time procedure started and ended, the client reaction or response to the procedure, and record the client output if required. So the rationale for this is a careful record is important for documenting after the client care. So the reporting and recording the important information about the procedure must be accurate and timely for continuity of care. Check the order on the client chart. So the rationale for this is removing of urinary catheter is only done if with medical order. Performing hand washing is held to prevent the spreading of microorganisms. So, with a ticket, call out the client name and check the identification band and explain the procedure to ensure the right client and elicit cooperation. Hi, Mrs. Smith. May I see your respect? Okay. So, Mrs. Smith, I will be removing the catheter. So, I will be inform you that there may be a slightly discomfort as the catheter is removed. Okay, thank you. Place the absorbent towel in the mattress under the catheter to protect the bed linens from moisture and gating salt. And get the syringe. Attach the syringe to the balloon port. Withdraw all the water or solution from the balloon. And hold the absorbent towel in your non-dominant hand in front of the perineum. Pinch the near meatus with your dominant hand and pull it steady out onto the absorbent towel until the end is retrieved. Hold the catheter and upward to the drainage tubing to so that may urine it will drain into the drainage bag. So inspect the catheter to make certain it's intact, and if it is not, notify the physician immediately. So measure the output in the drainage bag, record the output on the INO sheet, empty the urine into the toilet bowl, and dispose the urine bag into the yellow bin. Do and remove the absorbent towel in your and discard. Remove gloves. And throw away into the waste receptacle. Make the client in comfortable position and instruct the client to drink extra fluid, and warn that there may be mild burning with the first few voiding. Remind the client of the expected voiding time. So document the time of removal and time by which client should have next voiding time. So the rationale for this is a carefully record is important for documenting data after the client care. The reporting and recording of the information about the procedure must be accurate and timely for the continuity of care.